In a few minutes, I will introduce you to our speakers. But first, I'm going to try to set the scene a little bit by framing some of the whys and the whats around today's topic. And the rest of our session will hopefully focus more on the how. Specifically, why is health system strengthening so important to preventing and treating malnutrition at scale in fragile contexts? What is a shock responsive health system and why is it important? And why do we need to somewhat rethink the funding models used to support this work? Before that, however, I'll start with the fundamental why, which is why is this important? And I won't rehash the statistics here too much, as I'm sure most of you are very familiar with them, especially in these weeks leading up to the N4G. And you would almost definitely already agree that there are still an unacceptably large number of malnourished children in the world today, despite progress over the last decades. UNICEF, WHO, and the World Bank estimate that roughly 145 million children are still stunted, 45 million are wasted, and of those, about a third are severely wasted. And to date, UNICEF also estimates that only 1 in 3 of those severely wasted children are accessing the treatment they need to recover and to survive and to hopefully thrive. From these figures, it is very clear that we need to do more work to prevent all forms of malnutrition. And unfortunately, we also still need to ensure wasted children have access to treatment services when they need it. Leads to my first question: why is health system strengthening so important to preventing and treating malnutrition at scale in fragile contexts? Well, first, a big piece of the malnutrition prevention work must be done via health systems, namely preventing and treating the illnesses that contribute heavily to malnutrition at both the facility and the community level. We know food systems are, of course, central to this, but the importance of the health system should not be underestimated in the fight to prevent malnutrition. Second, the treatment services that are needed to address child wasting must be delivered via the health systems. Again, I'm talking about health systems at facility and community level. Nutrition services are usually on paper part of the essential health package in most countries. In practice, however, they're not always truly integrated into the health service. This is particularly the case for treatment services for child wasting. For example, management of ready-to-use therapeutic food is often funded and managed in a somewhat parallel fashion. So in countries with a high burden of malnutrition, better integrating nutrition services into health systems, we think, is the only way to reach scale, even in fragile contexts. The government health system, however weak, is the backbone of health service delivery in any country. And we'll hear more about this from Mado Diakite shortly on Niger, who is furthering this integration at scale. The second question: what is shock responsive health system? What is a shock responsive health system and why is it important? As we know, health systems in fragile contexts such as Somalia, South Sudan, Sudan, or Chad are usually overstretched at the best of times. And just like more stable countries, these countries need coordinated, sustained efforts to strengthen the basic building blocks of the health system, to ensure, for example, that health staff are present, they have the technical skills they need to deliver services, and they're being paid. And we also need to ensure that medical supply chains are functioning. Health systems in fragile contexts, however, also need to develop built-in strategies to be able to cope with the many shocks that they face on a regular basis, such as active conflict, population movements, drought, floods, and economic crises. This means health teams at facility, district, and national level need to better anticipate and prepare for those shocks. And health system resilience is a concept that is gaining more recognition. The CMAM surge approach was developed by Concern and partners to help health systems better anticipate, prepare for, and respond to seasonal peaks or surges in child wasting specifically. And Concern feels that this approach is important, and ECHO is currently supporting the continued development and scale up of the CMAM surge approach via the ERNIE program, which you'll hear about in a minute from Amina and Barbara. Which brings me to the third question: why do we need to rethink the funding models used to support this work? We know that stop-start funding cycles are not efficient. They often come too late. So we really need multi-year flexible funding. And that was clearly recognized in the commitments made by stakeholders, including donors, under the 2016 Grand Bargain, which was renewed in the Grand Bargain 2.0 earlier this year. Specifically, signatories agreed to work towards a greater amount of quality funding being transferred to humanitarian partners, including a greater proportion to local actors, to ensure a high quality response that is at scale, timely, and relevant. So moving on to why now, 2021 has been the Nutrition Year of Action, and today's discussion builds upon a number of important initiatives leading up to the N4G in a few weeks. There's currently a strong refocus on preventing and treating wasting. Following the Global Action Plan in 2019, we've seen the launch of the country roadmaps just this week, outlining how 23 high-burden countries will be tackling wasting in line with the Global Action Plan. The Wasting Reset Call to Action and UNICEF's No Time to Waste were also recently launched. And earlier in the year, Concern and Irish Aid hosted a 4-day conference entitled CMAM, 20 Years On, which looked at how CMAM, the community-based management of acute malnutrition, has been and can be further adapted to reach the remaining 70% of severely wasted children who are not accessing the care they need. So I invite you to read that conference report, which resonates with many of the same recommendations, and also which is available on the Concern website, and also to read the 6 excellent papers that are linked to the Wasting Reset Call to Action. And now to introduce our presenters and panelists. Today we have a panel of expert speakers, each with unique insight and experience of working to reduce malnutrition and build the resilience of health systems. We'll first hear from Concern's Regional Director for the Horn of Africa, Amina Abdullah. Amina will speak to us about the Enhanced Responses to Nutrition Emergencies Program, which is an ambitious 3-year program that aims to reduce morbidity and mortality in children under 5, which is being implemented by Concern across 5 countries and is supported by ECHO with multi-annual funding. Unfortunately, Leonard Mizzi from the European Commission's Department for International Partnerships, known as DG INTPA, cannot join us as planned, but we're delighted to join 2 representatives from the EU Commission. The first is Barbara Decans, who is the team leader for sectoral policies, health, nutrition, food assistance, WASH, and shelter within DG ECHO, and will speak to us about ECHO's pilot programmatic partnership with UNICEF and Concern, which is the funding stream that supports the work that Amina will describe. We will also hear from Helena Guarin, who is the head of sector of nutrition and One Health from the European Commission's Department for International Partnerships as well, who will represent her colleague Leonard Mizzi and speak about the EU Action Plan on Nutrition. Unfortunately, our 4th speaker, Dr. Osman Nassirou from the Ministry of Public Health of Niger, is also unable to attend, but we're very lucky and grateful to have Mado Tiakite, Technical Assistant to the Niger government on food and nutrition security, social protection, and the humanitarian development nexus. Thank you, Madhu, for stepping up to speak about the experience of Niger, who has been on the forefront of innovating in the field of nutrition. We're also joined by Patrick McManus from Ireland's Department of Foreign Affairs. Patrick is Deputy Director of the Policy Unit at Irish Aid. In October this year, the Irish government increased its commitment to overseas development assistance, bringing it for the first time in history to over €1 billion. Irish Aid recognizes the importance of multi-annual funding and the necessity to build flexibility across budget lines to enable humanitarian actors to respond to changing contexts.